Welcome to the On Your Mind podcast, where we believe mental illness can be temporary and transformative. Stay tuned for innovative, effective tools from experts in the field of mental health. Hosted by Timothy J. Hayes, psychologist. This podcast aims to change the narrative around mental illness. Move from a place of fear to a place of hope and solutions. Here on Your Mind.
Dr. Frank Yurasek has completed 28 years of experience in practicing Oriental medicine and delivering highly effective patient outcome results through these methods. Dr. Yurasek has been president of the Eastern Medicine Group since 1988. He has published the Oriental Medicine Journal for more than a decade. In recent years, Dr. Yurasek has zeroed in on the plight of veterans, particularly the following areas: post-traumatic stress disorder, silent suicide epidemic among veterans, and pain afflicting veterans and non-veterans. Thank you so much for joining us here today. It's an honor to finally meet you face to face. And I'm hoping that you'll share a little bit with us about what got you started on your current journey and what drives your passion for it.
Sure. It's so interesting because I spent 25 years thinking that my career was going to be marketing and advertising. And suddenly I took a sharp right turn and discovered acupuncture, basically because my wife was in need of it and nothing else was working. So I thought I'd try this. She had a very bad case of TMJ. They wanted to cut the nerves in her face because she had TMJ and tic Larue, which would paralyze her, scar her, and had about a 50% chance of working. And I said, let's try something else. It just so happened we lived about 2 blocks from this acupuncture school that had a clinic, and 6 needles, 20 minutes, $20 later, she had no pain. That got my attention. I had started in pre-medicine, decided I didn't want to do that. So I went on, I got a scholarship and teaching fellowship in Lit, did that for a couple of years, got into advertising because that seemed to be the thing to do. And it was only after 25 years of that, when I was desperate for something other than surgery and drugs, I discovered this medicine that I had only been mildly curious about. And wouldn't you know, a couple of weeks after that experience, a little ad appeared in the Reader newspaper that said this doctor from China with 40 years of experience, 3rd generation, was going to have classes above a bar in Rogers Park called Biddy Mulligan's Bar. And so I said, this must be providential. So I started showing up, and the more I learned, the more I wanted to learn. And a year later, he asked me to be his assistant, which I did. And at that time, acupuncture was a class 4 felony because they wouldn't license it. You could do it if you didn't know anything about it, but you were an MD, or if you knew a little bit about it and you were a chiropractor. But other than that, you could not. And I was so impressed with how it had treated my wife's condition that I did this internship and then started practicing after a year of study and 6 months of internship. I started practicing with Dr. Han in Chinatown and did that for about 6 months and then broke out on my own and decided I wanted to get a little more formal education. So this was back in 85. So I went in for a 3-year program while I was working full-time in marketing and advertising and doing acupuncture part-time. And then from there, went on for a doctorate and never looked back.
When you say you went on for a doctorate, what did you get your doctorate in?
It was in traditional Chinese medicine. So that included herbs and Tui Na, which is the manual therapy, and Qigong, which is the energetic exercises. So acupuncture, herbs, Tui Na, and the Qigong exercise that we have people do. It's a lot like yoga, and it's very specific for different conditions. So it's those 4 studies. And I've been back and forth to China 15 times. I did my doctorate on drug and alcohol using acupuncture for 16 years with the state's largest drug and alcohol treatment center up in Waukegan. And then I had a private practice at the same time. So that was basically the early years. And for the last 16 years, I've been working in a hospital-based practice as director of acupuncture with Cook County Hospital, with the Stroger Hospital, actually. I'm trying to think. Jim Dolan, somehow we hooked up. I was the chair of the program over at National, and I decided I wanted to spend one day a week treating veterans because my son is a Marine veteran. My brother is an Air Force veteran. My father-in-law was a World War II veteran. So I tried to get into the Marine aviation when I was in college and flunked the eye exam and then went on to law school. So I never served, and I had a lot of buddies of mine that did, some that did not come back. So I decided that my service would be working with veterans, primarily suffering from pain and PTSD. And in that process of making some noise about that over at the clinic at National University in Lombard, I ran into Jim, and he started being my front man and bringing veterans over there. He was involved with joining forces, and it just grew like Topsy to the point where we were seeing 45 veterans a day, and then also doing stand downs, 4, 5, 6 stand downs a year, where we would see up to 400 veterans on a weekend.
Currently, how much of your time is spent with the Healer Warrior Project?
Because of COVID, I backed off a lot from that. I was doing regular classes, monthly classes online, and had a pretty robust veteran clinic at my clinic in Oak Park. And then we had an arrangement where we signed an agreement at Stroger Hospital between Stroger and the VA, specifically with Jesse Brown. And so we were doing that. And then, like I say, things kind of went a little sideways on our side and on Jesse Brown's side. They stopped really opening up their facility, and ours as well, to people other than this essential services and emergency services. So we backed away from that. There haven't been any stand downs. There have been virtual stand downs, but there haven't been any of those lately as well. So we really kind of went in hibernation for the last year.
So when you're working with veterans, one of the things that is talked about in the bio you have, or the write-up you have for the Healer Warrior Project, is working with PTSD, working with people who are depressed or have, tendencies towards suicidal thoughts. Can you tell us a little bit about how what you do is positively impacting those veterans?
Yeah, this is a great question because it could be subjective. There is a 10 question or 16 question questionnaire that we would have veterans fill out before their series of treatments and after, 6 to 8 weeks after, and compare the scores. But I found that the most accurate way to see if there's change is use something called heart rate variability, which measures the balance between their sympathetic and parasympathetic nervous system, between their fight or flight response and their rest and relaxation response. Usually with people with PTSD or in pain or both, they're way into the fight or flight mode, which dumps cortisol into the system. It increases inflammation. It keeps pain and trauma at a high level from a body-mind emotional point of view. So we found actually a classmate of mine and I did a study at one of the stand downs, and we did real time before, during, and after our auricular acupuncture using 5 points on the ear. And we tracked their sympathetic, parasympathetic balance. And we found as soon as the needles were in, we also did electrical stim, and we also did these little tiny vicarious seeds on the same 5 points, depending on which stand down we were working at and how many people we had in line. And we found that the majority of the veterans that we were treating went into that autonomic balance, where the sympathetic, parasympathetic nervous systems were in a state of balance, which was a significant pre-runner to the fact that they would start being able to sleep better, they'd have less anxiety, they would heal faster, because all those things are linked to that balanced autonomic nervous system.
Now, is that heart rate variability that you're talking about there the same kind of thing they mention with heart math, that they're registering with the heart? And how is it that you measure that?
So we put a strap on their chest, and we have a special software that was designed by this Russian scientist, Dr. Alex Rivkin, who pioneered this software with 100,000 Russian sailors to see if they were fit for duty. And over that period of time, he refined this software and brought it over to this country and started using it in hospitals to help with trauma and with heart disease and with fitness. So the other application of that, he's got a fitness system that's Apple. You can put it on your Apple phone, and it's basically telling you what shape your heart is in as you exercise. So that's just another variation of that.
So have you done follow-ups with people that you've been treating in terms of the dynamic impact on their depression or their post-traumatic stress disorder symptoms or their suicide ideation?
Yeah, that was pretty much part of our questionnaire that we would do before they started therapy, and then 6 weeks later, all of those, there was key questions designed by the VA that would put a scale in place in terms of those conditions. The HRV, heart rate variability, is a lot more precise than that. It's specifically measuring that autonomic balance, and as that balances, there's direct indication that a lot of those symptoms are going away.
And so does the heart rate variability stay in that healthier, balanced state even after the needles are removed, even after the treatment with you?
We were seeing them once a week at the clinic in Lombard, and that was staying in place, yes.
Excellent. Well, and you mentioned, in this write-up for Healer Warrior that there's this kind of silent epidemic of suicides among veterans. And there, as we know, there's a complex set of factors that contribute to that. Can you say a little bit more about this package that you do? It's not just the acupuncture or the auricular acupuncture, it's also herbs and qigong and...
Well, so the whole idea about Healer Warrior was self-care. So qigong is something that the individual could do. We have a system with either the auricular, where the wife can get involved, or these are all homunculus based or little man based. So there's this upside down fetus on the ear, which it's very easy to get the idea of what part of the ear relates to either what organ or what part of the musculoskeletal system. We have the same thing with the hand system, which came along a little later. The auricular system was discovered by a Dr. Noget, who was a neurologist the hand system was discovered by Dr. Tai Woo Yu, who's a Korean acupuncturist. And again, you can treat the whole body from a part of the body. The part contains the whole, just like with the hologram. It doesn't matter where you snip the film. If you shine a laser through it, you get the whole image. And so we have the same property with these holographic areas of it could be the scalp. So there's a scalp microsystem, there's an ear microsystem, there's a hand microsystem, and there's even an abdominal one where the ancient drawing was of a turtle. It's called sacred turtle. And I went to the World Congress of Acupuncture federations from all over the country. They have 250,000 members. And they had a convention in Houston a few years back. And so there are these two Italian orthopedic surgeons, and they're giving a lecture on the sacred turtle area of the body that you can treat the whole body from. And they have video clips of one guy just had neck surgery and could barely move his neck, was in extraordinary pain. The other guy had knee surgery, older gentleman. He could barely move his knee. He was right out of surgery, within hours out of surgery. And in both cases, they went to the area of the body that relates to that area of the abdomen and got immediate pain relief and more flexibility. Now, what I have put together based on this happening, whether it's from the ear, from the hand, from the scalp, from the abdomen, is that is a neuroplastic response. That what you're really literally doing is waking up another part of the brain to take over function. By going remote rather than to the area of pain, you go to another area of the body. And the latest mantra for neuroplasticity is attention, intention, rehearsal, AIR. And that was something that was developed by this psychologist from Loyola, DePaul, who had a traumatic brain injury from an auto accident, spent 10 years trying to get his control of his body back. And with the help of this doctor, she was a ophthalmologist, and she worked with him to use sight and this idea of paying attention to what is missing and what is there, and having an intention to put what's there that isn't there, and take away what is there that you don't want, and to rehearse that. And he, after 10 years of suffering, was about 80% recovered. I've used this technique using these microsystems of the hand, the ear, the scalp, and the abdomen. They all have the same common denominator, in that as you stimulate that area of the body that connects to the brain, and you have that person go through a movement that they haven't been able to go through, somehow that kicks in to have that function restored. Not necessarily instantly, although sometimes instantly. And the best example of that, if you ever go on to the internet, onto Google, YouTube, and look under Dr. Zhu, Z-H-U. Dr. Zhu is the scalp acupuncturist that you'll see pictures of people in wheelchairs or just totally dysfunctional, haven't walked or stood for years, and get up and immediately start being able to function. I've seen that in my own practice. I've had people walk out with their walkers under their arm, stand up from wheelchairs, I've had a young girl with a through and through drive-by shooting where her shoulder was paralyzed. And you go to these areas of the body that have been mapped out by famous acupuncturists, either recent or ancient, and you have this immediate recorrection or function. The best example of that I just gave at the pediatric department at Stroger Hospital is this point on a little toe of the mother that when you stimulate it, the baby flips from a feet first to a head first position. And the only way I can explain that is neuroplastically.
It sounds a lot like the kind of thing that Moshe Feldenkrais was developing in his work, to get one part of the brain to take over functioning that another part had ceased.
Exactly. Yeah, he's a favorite of mine, Moshe. And it's so interesting. He was in the same building in Tel Aviv as, let's see, who was the guy that did such brutal deep tissue work?
Rolfing?
Yes. It was a woman, Ida Rolf and Feldenkrais were, they didn't know each other well, but they did pass by each other. They were peers at the same time in this bodywork business that from different spectrums, different areas that really help people recover from paralysis and dysfunction. And there's a Japanese counterpart whose technique I use. He is Dr. Hashimoto, who was captured by the Russians during the Russian-Japanese War and prisoner of war for something like 6 years, and he had a lot of time to think. He came home back to Japan and put together this exercise therapy called Sotai, 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 which means puppeteer. Means getting hold of your own strings to control your body movement, to restore function, which again is very much like this paradigm of neuroplasticity. And he would find out every joint moves in 8 directions. And so he would compare one side of the body to another, whether it was an arm, a shoulder, an elbow, a hip, a knee, and plot that out. And here's the kicker. He would take the body the way it wants to go, as opposed to physical therapy. You're trying to force it and make it work where it doesn't. He went in the exact opposite direction. Take the body in the direction of ease on the exhale slowly, and that would reboot the body. And so I do that a lot while the needles are engaged, whether they're engaged in the scalp or the ear. So I get this synergy, synchronicity, actually, I think is the better word. I get this synchronous movement restored as I tease the body with it can be either electrical stimulation, laser stimulation, needle stimulation, pressure stimulation. Any of these will work to signal that pathway, whether you call it a nerve pathway or an acupuncture pathway. In fact, there's an English physician who wrote a wonderful book, The Spark and the Machine, who talks about the acupuncture pressure vessels or meridians being these pathways that are really fascia, and that the chi is really a piezo electrical spark or stimulation that goes along these fascia planes in the body. So he's really done a good job of trying to put it into more of a Western vernacular.
It reminds me of something I heard about. It's orthomolecular bionomy.
Yeah.
Have you heard about that?
Yes.
It's really, the same kind of thing you're talking about, where every joint will move in 8 directions, and you do this very gentle breathing, and you ask the person to let you know what feels best out of the 2 pairs of the 4 different pairs. And
Yes.
and then you hold that and breathe until you feel the pulse, and then you move to the next direction. And by the time you're done, I mean, there have been a lot of times that I've used that and I've seen other people use that where they're just amazed at
Yes.
the release
It's rebooting
and ease that happens.
Yes. Yes. It's wonderful. Very much so.
Well, so assuming that this is going to pass sometime, all of these coronavirus restrictions and things, if people go to healerwarrior.us, that's one good way to find out a little bit more about you and what you do. Where would you, if people wanted to contact you after this, whether they're veterans or they're other people who've been through issues that the traditional or the conventional medical model will not assist them with, how would you prefer people try and contact you?
I'd like to answer that, but before you say after COVID, I'd like to say 2 things about COVID. One thing, 2 weeks ago, 2 Sundays ago, the New York Times had an 8-page article on people called long haulers. And these are COVID survivors that still have symptoms, some that have gotten worse or new symptoms that are open-ended, still of considerable challenge to them. And what they found out, and this goes back to heart rate variability again, is that the majority of time, one of the main things in common with all these people is their autonomic nervous system is out of balance. They are stuck in the fight or flight response. And then I go back to these points on the ear that can tip you back into a more balanced autonomic nervous system and allow you to reboot and reheal. Now, no one's done that with acupuncture as it relates to COVID long haulers, but there's a lot of money that's been put aside by NIH. I'm in the process of putting together a proposal to see if I can do research actually to test this. I may just also do a pilot where I'm comparing people that are using conventional therapy versus people that are using auricular that's going to rebalance their autonomic nervous system and see how those symptoms may dissipate or not following that therapy over a course of weeks of therapy. The other piece is that most people who suffer from COVID are comorbid. They have diabetes, or they have cardiac issues, or they have pulmonary issues, or they have kidney issues. All those can be addressed by acupuncture and herbs and qigong. And so it's the old story that by getting someone healthier in general, that the best offense is a good defense, that you can actually protect yourself by moving into better health away from these issues that you've been kind of trapped in with conventional therapy that really hasn't improved it. You're just kind of treading water there. Whereas we very much look at causes as opposed to symptoms, and we treat causally in terms of these conditions and seem to be able to get people out of the woods and back into a more normal function. So, and again, when you're talking about function, you're talking about when you restore function, about this neuroplastic ability of the brain to heal itself. As Daji says in his book, How the Brain Heals Itself, he says, the way we are programmed, the mind controls the brain, and the brain controls the body. So if you want to change what's going on with the body, you start with the mind.
Wonderful. It's certainly been so many different modalities that I've been exposed to over the years prove that out. And the physical aches and pains that people have come into our offices with and they walk out without them, and oftentimes it's been, 8, 10, 12 years or more. And so they're in tears, not from the pain, but from the idea that they're no longer in that pain or that restriction of motion.
Yeah, they're hopeless. Yeah. And veterans, so when you're drug dependent, when you're, the only relief you get is temporary, and it's through sedation of the brain, which really is kind of antithetical to neuroplasticity, because we want to wake up the brain to kick in, and you can't do that very well if you're drugged. So it's so interesting because the VA in Detroit has now required that all patients going into surgery get this battlefield acupuncture, which is 5 points on the ear, because they found that there is a 50% reduction in opiate use following surgery and the use of this battlefield model, which I trained in with John Howard out of Maryland, and used with shocking effectiveness on marine amputees with phantom pain. So
it's powerful, and it reminds me of Peter Levin's book, In an Unspoken Voice, and he's mapped out quite a bit from his personal and clinical experience, that whole process that so many of us go through, even if it's just for an orthopedic issue, even if it's not battlefield, but any kind of a surgery or any kind of an orthopedic procedure where we have to be restrained, that he calls that, that tonic immobility. And if that is paired with fear, how much that gets rooted in the brain's response system, and how it can be mitigated, like you're talking about, going in, using your auricular technique prior to it, calming everything, getting that balance going, separating the immobilization from the fear or terror, and how it can actually be resolved even after the fact with this awareness of the balance in the brain and the connection between what the body has learned about the tonic immobility and the fear.
With you mentioning that brings back a Qigong exercise. It's called the 6 Healing Sounds, where you actually make a sound as it relates to one of the meridians. The kidney meridian, which goes through the kidneys, that's the only reason it's called the kidney meridian, starts on the sole of the foot and goes upward to along the front of the body. That's an area where I was taught in China to use this tapping therapy on kids that had cerebral palsy, and I just used it on a little girl with Rett syndrome, and watched, to my amazement, as she was able to walk again. Because once that degeneration starts, it really, there's no going back in terms of improvement. But with this tapping on the kidney meridian, I was able to, or this therapy was able, it's not about me, it's about how the body has the ability to reboot. So the thing is that we have this ability to restore ourselves. And I'm trying to remember what the point was I was trying to get to on this, because I did.
Well, we had just talked about the auricular therapy prior to surgery in the VA in Detroit.
Yes. Okay. So the healing sounds. So there is a sound that you make, you resonate throughout your body using your mouth as a resonating chamber and breath. And that resonates with the kidney meridian. The kidney meridian controls the bones, the reproductive system, fear, hair, immunity. It is the fundamental source of energy, starting energy, very important for kids. And that's why you hit these kidney points on the back just above the buttocks, because that's where the master points for the kidney is. And the kidney also brings down lung energy. So that's why that breath starts. So anyway, this sound, think of Chewbacca, huh? Which is his nickname was Chewy. And that's the sound you make. You actually fill up your lungs. That vibration stimulates and harmonizes the kidney meridian and the body and all those things that relate to that. And the ear is the external opening of the kidney. That's why auricular medicine works so well. So, I mean, there's all of these overlapping connections that are so multidimensional, huh? It's just amazing. It's just amazing.
Well, it's a delight to hear about some of this. I think that we mentioned the healerwarrior.us is one place people can connect with you. Is there another?
Yes. So AccuWorks, ACUWERKS, is my Gmail. Right now, I'm pretty covered up at Stroger, and I have this school that I'm working at. It's a new acupuncture school that has me pretty covered up. I do see patients on Saturdays and a couple of evenings a week, but like I say, with COVID, I pretty much let that go and have just concentrated on my practice at county and getting the new school student clinic up and going as well. That's on Michigan Avenue. But if people want to text me, they can text me through my cell phone, which is 708-466-7501. That's actually the best way. Or they can email me at AccuWorks, ACUWERKS, @gmail.com. Those are the two conduits to get me connected with their questions and hopefully some of their answers.
All right. So before I let you go, let's just be clear. Are you talking about a school where you're going to teach people to do what you do with?
Yes,
the
exactly. In fact,
acupuncture and
I have a Qigong class there on Thursdays to our class that'll be going through May. And we'll have a lot of online courses. There'll be both, and that's where I'll be also teaching this battlefield acupuncture at that school. I've got a couple of surgeons that are interested, some chiropractors. I think because you can use laser therapy or electrotherapy that's non-invasive, I'm hoping that we can bring in massage therapists and other folks that would normally be prohibited from using
needles.
acupuncture needles.
Right. Well, I greatly appreciate your taking the time out of your busy day to share this knowledge with us, and I look forward to following your work. And
thank you.
I'm in awe. And so people can find you at healerwarrior.us, or they can reach out to you in any of the other two ways you just mentioned. And thank you so much for your time. I appreciate it.
My pleasure, Tim. Thank you for your work as well.
All right. Take care.
You too. Bye-bye.
Dr. Frank Yurasek has completed 28 years of experience in practicing Oriental medicine and delivering highly effective patient outcome results through these methods. Dr. Yurasek has been president of the Eastern Medicine Group since 1988. He has published the Oriental Medicine Journal for more than a decade. In recent years, Dr. Yurasek has zeroed in on the plight of veterans, particularly the following areas: post-traumatic stress disorder, silent suicide epidemic among veterans, and pain afflicting veterans and non-veterans. Dr. Yurasek began studies and practice of Eastern medicine in 1985 to seek relief for his wife's intense pain. He attended Midwest College of Oriental Medicine, where he received an MS in Oriental Medicine and his PhD in Oriental Medicine in 2002. Dr. Yurasek was a professor of Tunai and a clinic supervisor since 1996. He has interned in China and Japan and has lectured across the United States. Dr. Yurasek is currently Chief Clinician of Acupuncture and Oriental Medicine at National University of Health Sciences. He also serves as Vice President of the Board of the Illinois Association of Acupuncture and Oriental Medicine. As an author, clinician, martial artist, mentor, and teacher, Dr. Yurasek uniquely ties together his various disciplines and experiences to present Oriental medicine as a powerful, problem-solving tool and a restorative health modality. By demonstrating how acutherapy is applicable to relieving pain and other chronic conditions that are characteristic of our American culture, Dr. Yurasek is demystifying Oriental medicine. By placing an emphasis on self-help, Dr. Yurasek is making Oriental medicine more accessible and empowering people to take control of their own health.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.